BusinessJournalDaily.com. 3 Minutes With is brought to you by...
I want to retire knowing we did it right. We want
to know that it's been worth something.
It's worth everything.
Be intentional about your worth. Farmers National Bank Wealth Management.
I think it's a really good opportunity to educate our consumers as far as some of the challenges, what is going on in our healthcare landscape, not only from a care standpoint, but also from a reimbursement standpoint.
We're getting a more medically complex patient in long-term care, especially in the short-term rehabs.
I think it was important to discuss that there are staffing challenges in the area, but all of the companies are working hard to try to provide outstanding care to the patients.
I think as we heard today from Direction Home and from some of our other providers, that it's all about education, and I think it starts when they're at home, just trying to gather as much opportunity and services, whether it's attending health fairs, also when someone does go to the hospital, really spending time with their discharge planner and listening to what they have to say.
People come to the facilities expecting a full 100 Medicare days, feeling like that they're entitled to that, and really these companies, managed care organizations, are controlling the length of stay.
This whole new reimbursement system is really value-based care, and I think really CMS's effort is really to make it more of a managed care payer, like what we've been seeing over the last couple years here in the Mahoning Valley. Our Director of Clinical Services did a fantastic job with our sites and really just looking at all the different training modules. And again, they're getting away from the typical therapy minutes as the driver for reimbursement, and they're really looking at more other components, more clinical outcomes, more clinical components, comorbidities, things of that nature.
There may be some kinks to work out this first month of reimbursement, but our managed care and Medicare payments, they come fairly timely. We are used to having a lag in payment.
So do I think it's fair about how we're rated? Not really, I don't.
I think CMA is trying to make an attempt to really have a report card of some sense as far as the outcomes that the facility produces. I think there are some components of the 5-star rating that is good. The quality measures, I think that that is based off of the assessments and the data that you submit. So if you are doing things correctly, then your quality measures are going to come out.
They're identifying this is the number of staff that you should have, but we're finding that sometimes just bulking up the numbers for the sake of saying we're going to have a 15-to-1 or a 10-to-1 ratio is not as effective as making sure we have quality caregivers, empathetic caregivers, and people who are really going to do an excellent job taking care of our residents.
I definitely feel that people need to actually come and tour the facilities prior to coming.
As soon as a person walks through the front door, they will get a feeling if they want to place their loved one in that facility by how they are received by the staff, how the patients look, the overall environment of that facility.
BusinessJournalDaily.com. 3 Minutes With is brought to you by...
I want to retire knowing we did it right. We want
to know that it's been worth something.
It's worth everything.
Be intentional about your worth. Farmers National Bank Wealth Management.